Okay, I think I've been able to sort out YouTube. All right, good afternoon, everyone. I hope we're all doing great. I have to apologize in advance in case you hear some noise in my background. There's something that is disturbing. I think they are doing some work in the compound. So, apologies ahead for any background noise that you may have to deal with. That said, welcome everyone again to another conversation on Dr. Max's health support community. It's good to have everyone here, and I hope you are all doing well. I hope everyone is feeling good and everyone is having a restful weekend. Remember, the weekend is to rest. Okay, last week we had a very engaging session, going back and forth with everyone, asking questions and getting the feedback, which thoroughly convinced me that everyone on this platform has been paying some serious attention, and I can only hope that all the knowledge that was displayed last week is being practicalized, because it was very obvious that people were paying attention and people have learned a lot. So for anyone who is new, especially on my YouTube channel, I'm Dr. Max. This is Dr. Max's health support community, where I give you information to make health goals. Sorry, information to help you meet your health goals. Sorry, just a second. I'm having some audio interference. Let me just try and check what's what's happening with that. Okay, all right. I've gotten that sorted out. Uh, All right. So I was introducing the community. So for health information, and for you to ask any health questions you might have regarding your blood pressure, weight loss, diabetes, or general medical questions that you might have, and you can um, ask your questions at any point in time. You can drop your questions on the group. For those of us on WhatsApp, for those of us watching me on YouTube, you can drop your comments and your questions in the comment section. You can ask a question about anything whatsoever. Okay, it doesn't have to be related to the topic. As long as it's medical, I'll do my best to answer. And I think now we can go into the topic of today. Weight loss drugs. That's the topic. And it's a really big one recently, because it seems to be a silver bullet, a shortcut, and a lot of people are trying these weight loss drugs. In addition to the fact that they are even popular celebrities, and these celebrities, quote unquote, have endorsed these drugs. So I'm going to run through a few things that you need to know about weight loss drugs. I'm going to run through a few things you need to know about weight loss drugs, and then we'll take it from there. Okay. Um, so for starters, first things that you need to know. Number one is no weight loss drug works alone. That's the first thing. So a few general ground rules about weight loss drugs. And in fact, I'm going to start by saying weight loss drugs are not in themselves bad. Another thing that you need to know, there is no drug that you will take that will just go into your system and melt all the fats. Every weight loss drug has a mechanism of action. In medicine, we call it mode of action, MOA. All right, the pharmacology of the drug. So, what or it basically tells you how this drug works for you to see the effects. It's important that you keep this in mind so that when we start talking about some of these drugs, you understand whether or not you should be using this drug. So, because a drug has the way it works, understanding the way the drug works will help you know whether it's a drug that you should use. I hope that puts things in perspective. Yes, everybody wants to lose weight, but if a drug does not address your own problem, the reason why you are gaining weight, then the drug is useless to you. If a drug is going to help you lose weight, then the mode of action must be effective for the problem that is making you gain weight. Let me say that again. If a drug is going to help you lose weight, then the mode of action must target that problem that is making you gain weight. Classic example, you see someone who is vomiting. The person might have malaria. The person might have food poisoning. The person might be pregnant. What else? The person could even have cancer. Now, if you decide that, oh, for everybody who is vomiting, treat malaria, well, it will work for that person who has malaria. The vomiting will stop after you've treated the malaria. But for any other person who is vomiting, that malaria treatment might not work because if the reason is pregnancy or food poisoning or cancer or something related to the stomach, then your malaria drug is useless. It is the exact same thing with weight loss. Everybody has weight loss the same way you can have 10 people who are vomiting in a hospital. You can have 10 people who want to lose weight, but they all have different root causes, and you need to identify which drug addresses which root cause of the weight. So that's just something that you will need to put in mind. So we are not just discussing theory for theory's sake. We're not just doing pharmacology for the sake of it. It's to help you know how to make decisions and if you should even be on weight loss drugs. Okay, rule number two, I think, for weight loss drugs. Obviously, no weight loss drug works alone. You go and check the studies they've done. You would always see it's supposed to be used, the drugs are supposed to be used alongside lifestyle changes. Okay, that's is a given. Everybody should just know that by now. Okay, now I'm going to talk about just a few. There are so many weight loss drugs out there, but I'm going to talk about just a few of them, the most popular ones, and what you need to know. Okay, the first one I'm going to mention, sorry, before I mention that, rule number three for weight loss drugs. All weight loss drugs, so far, at least the ones I've researched and the most popular ones out there, they are not prescribed for everybody. They are not prescribed for everybody. So generally, and you might want to write this down, weight loss drugs are prescribed for people who have a BMI above 30, and that's what we call obesity. Your BMI is above 30, or people who have a BMI above 27, but they have other conditions that are being caused by the excess weight. In other words, this weight is starting to affect the heart, it's starting to affect their blood sugar, it's starting to affect their joints, it's making mobility difficult. These two classes of people are the people who typically, medically speaking, are supposed to get weight loss drugs. So, if you recall from some of our earlier conversations, I always mention that before you even start losing weight, check your weight, check your BMI. All right, and you can see why. Because if you check your BMI and it's over 30, then you know that you're actually a candidate who is qualified to use a weight loss drug. It's something that will probably make your journey easier. So please, if you haven't checked, go and check. That said, I need to make another ground rule. I'm not here to prescribe these drugs. I'm here to inform you about these drugs, because the people who want to sell these drugs to you will tell you anything they need to say just to give you that drug. Oh, the drug works wonders. You will lose 100 kg in 3 weeks. This, that. They won't go down into the mode of action. They don't care whether it would work for your own particular case. Like I mentioned just 3 minutes ago, that knowing the root cause of your weight gain will determine the kind of weight loss drug you will use. But the people who want to sell to you are not bothered about that. They just want you to buy, whether it will be useful or not. And that's why I am here today, to give you proper information about these drugs so that you can now think from an objective perspective. Okay, now I can start. First is what we call phentermine. If you've been in the weight loss space, you've heard of phentermine. It's very, very popular. I think it's one of the earliest weight loss drugs that came out. Okay, now phentermine is a generic name. In other words, it's like saying um, acetaminophen. So let's just digress for 20 seconds. So acetaminophen is the active ingredient of paracetamol. So whether it's Emzo paracetamol, whether it's imported paracetamol, whether whatever it is they want to call it, whether they make it yellow or green, whatever it is, what matters is acetaminophen. That's the active ingredient. Now back to what I'm saying. For this one, the active ingredient is phentermine. So you might see other brand names, and for weight loss drugs, you need to know what is inside. Okay, you need to know what is inside. So phentermine is a generic drug. This is what is inside a lot of weight loss drugs. And few things to note about phentermine. The way it works is that it reduces your appetite and it increases your metabolism. Okay, now remember I said it must address your problem. Do you think you are overeating? It's a question that you need to answer. If you're going to buy a drug to reduce your appetite, but you already eat only once a day, so what do you want to reduce it to? So you end up taking a drug that will make you unhealthy, because by the time you drop from eating once a day, you are going to be eating maybe once in 3 days. That's going that's going to land you in malnourishment, right? So this is what we're talking about. So if your problem is not that you eat too much, you have no business reducing your appetite, especially if you're already doing once a day. Then I said it increases your metabolism. All right. So if we say that you want to start this drug, that means you need to have an idea of what your metabolic rate is. Now, while you might not be able to calculate that by yourself, you would look at your lifestyle. Do you move around? Are you active? If you want to increase your metabolic rate, but you are still just sitting down all day, then the problem is not a drug. The problem is that you are not moving. You need to get up and move. Okay, the drug is not going to come and replace that problem. The issue is that you are not moving, so your metabolic rate is very low. Your metabolism slows down when you sit down all day. So instead of getting a drug for that, why not move around and do exercises too? Why? Because I'm going to the next thing. There are risks. So now I'm going to tell you the risks associated. So I've told you the kind of people who can use weight loss drugs. I've told you how this particular weight loss drug works. Now let's talk about the risks of phentermine. Number one, it can cause palpitations. Your heart will start beating very, very fast. It can cause blood in your urine. It can cause difficulty breathing. It can cause heart problems. And to add to that, generally speaking, because I might forget to mention it later on in this video, generally speaking, if you are trying to get pregnant, or you're already pregnant, or you are breastfeeding, you have no business with weight loss drugs. Okay, just forget about weight loss drugs throughout those periods. Okay, for a lot of them, in fact, for almost all of them, you can't use them while pregnant. For the rest, they've not done enough studies to check whether the drug is safe for breastfeeding mothers. So whatever, whichever drug I'm going to talk about, this applies generally. Okay, pregnant, breastfeeding, or awaiting pregnancy, trying to get pregnant, you have no business with weight loss drugs. So those are the risks of phentermine. So it's something that you have to weigh. Next one we're going to talk about is Wegovy. All right, Wegovy. Very similar action to that of phentermine, reduces appetite, but it's also used to treat diabetes. Now, that's an important consideration to make, because if you don't have diabetes and you take the drug, keep in mind, people who have diabetes usually have very high blood sugar. So what the drug will do is that it will crash the blood sugar. Believe it or not, a lot of weight loss drugs actually have another function, that is a primary function, and then the weight loss is sometimes just a side effect. For Wegovy, it is used by diabetic patients to bring down the blood sugar. Okay, but it also has an extra added effect that it reduces appetite. So obviously, if anyone is going to take this drug, you have to be conscious of the fact that your blood sugar can crash and then you just faint. Also, low blood sugar is much more dangerous than high blood sugar. Someone can die from low blood sugar in less than a few hours. High blood sugar, you can still be walking up and down for months, for years with diabetes. Nothing will happen. But if the blood sugar crashes too low, that person can die. So it's something to keep in mind about Wegovy. Okay. So like I said, it reduces appetite and reduces blood sugar. Now, for some of the risks associated with Wegovy, it can affect your kidney, it can cause kidney problems. I've already said it causes low blood sugar. And in the long term, so I almost forgot about this. I've mentioned before that for a lot of weight loss drugs, you are not exactly expected to use them for long. You are not. No doctor is going to put you permanently on weight loss drugs. Okay? Now, for Wegovy, one of the effects after long-term use is thyroid cancer. Okay? Thyroid cancer. That is something to keep in mind. And that's why generally, please do not use any weight loss drug for a long time. Phentermine that we spoke about, it increases your metabolism, right? But when you keep doing that for a long time, you will definitely start to have problems. That's why you start to have palpitations, because you are using force to push up your metabolic rate. It's not organic. It's not like when you stand up and run. When you're tired, your whole body is tired and you rest. But when you're on a drug, it doesn't care about the rest of your body. To just raise your metabolic rate and force your heart to start pounding faster and faster. If you are doing physical exercise, You are not waiting for your heart to start pounding faster. When you are tired, you are tired. But with drugs, there's nothing to stop it, right? You cannot tell the drug, oh, stop, I'm tired, I want to rest. No, it's already acting on your heart directly. So that's something to keep in mind. So that was for Wegovy, all right. And anyone who has a thyroid issue, you can't use Wegovy. You can't use Wegovy if you have any thyroid issue. Okay. Next one, Ozempic. Ozempic. Let me be very, very clear. Very, very clear. And don't say you've not heard this. Ozempic is not a weight loss drug. Ozempic is not approved for weight loss. A lot of people use it because weight loss is a side effect of its major action. And what's the major action? The major action of um, Ozempic is to treat type 2 diabetes. That's the major action of them. It is a drug for treating diabetes primarily. So you are not supposed to use it for weight loss. Okay, I have to be very clear about that. So anybody telling you to get Ozempic does not like you. A lot of people have been using it, but it is a wrong use of the drug. Again, that side effect of crashing your sugar can be very dangerous, especially because you are not diabetic and you are just trying to use it for weight loss. Now, for people who are diabetic and want to use Ozempic, you have to see your doctor so that if you are taking any other medication, the doctor can know how to titrate your levels. Okay. So Wegovy and Ozempic actually contain the same thing. I think it's semaglutide, if I'm right. I just hope I'm not saying the wrong thing. But they contain the same. That's Wegovy and Ozempic. So Wegovy is the one that you can actually use for weight loss. Is approved, even though it treats diabetes. But Ozempic cannot be used for weight loss, even though it treats diabetes. It's important to get that very, very clear. So Wegovy, weight loss, Ozempic, no. Funny how Ozempic is now even much more popular than Wegovy for weight loss. It's wrong practice. Okay, so next one I'm going to just run through. Oh, I want to touch on one other popular one. Mounjaro. Mounjaro. This is also another very popular one that is being wrongly used for weight loss. Mounjaro is not for weight loss. It is a type 2 diabetes drug. Okay, what it does is that it increases your insulin levels to clear out excess sugar. Okay, and like I said again, weight loss is simply a side effect of using Mounjaro. Weight loss is a side effect of using Mounjaro. Um, so two drugs now that I have mentioned that are very popular. So you might want to write them down and note them so that when someone is saying buy this drug, you'll not be racking your brain. Ah, which drug did Dr. Macaulay say is not for weight loss? So write them down. Mounjaro and Ozempic. Okay, Mounjaro and Ozempic. These two drugs are being popularly pushed as weight loss drugs, but they are not approved for weight loss. Okay, so a few ones I'm just going to touch on just lightly. I'm just going to run through. So we have early starts. Early starts works by preventing fat digestion. So it actually prevents fat from being digested in your intestine, so the fat doesn't get absorbed. Again, I always tell you, ask yourself if this problem applies to you. Are you the type who is always taking a lot of fried foods and chips and oil and butter and all that? Or is your problem Coke and Fanta and all those sweet drinks and sugary drinks? Because if the problem is Coke and Fanta, this drug is useless. This drug is supposed to block digestion of fat. So for people who are taking fried foods, yes, this might be useful. But for someone who is fat because of the kind of junk drinks energy drinks and the like that the person is taking, this drug is not going to change anything. It will not help you. Again, understand how the drug works. So early start prevents fat digestion so that you can pull out all the fat. Oh, and I must also add that early start studies have shown that it doesn't necessarily make you lose weight. And I think what I just explained is one of the reasons. It doesn't help with appetite or anything, it just prevents digestion of fat. So it will only work on someone who has an issue with eating too much fatty food. And if you're eating too much fatty food, why not just stop eating the fatty foods? Like, seriously, make the work easy for yourself. You will now go and eat fried plantain and fried chips and fried egg and fried meat and fried everything, then you go and take oily start and expect it to perform magic. Well, yeah, I mean it will help, but how about you don't put it? Look, a general principle with weight loss is just don't put it inside your body. You see that fat that has not entered your body, that's the best fat and the easiest fat you can get rid of. The one that is still in your front that has not entered your mouth yet, easiest to burn. You just How do you burn it? You just remove it from your front. That's all. But when it enters your stomach, then it's another conversation entirely. You're not talking about drugs. So, risks of early starts, right? So, for those of you who think you can eat chicken and eat fried everything, fried, and come and take this drug to block the digestion of fat, it can cause bleeding per rectum. Bleeding per rectum is, I was about to say it's hematochezia, but that doesn't make it easier for you to understand. It's when someone is passing out bloody stool, more or less. Okay, and it can also cause kidney injury. This now, let me add, all the risks I'm saying, they are not exhaustive. There are so many more, but I decided to look out for the most dangerous ones. And of course, with every drug comes the risk of getting nauseated, um, vomiting, diarrhea. Those who are having an allergic reaction. Okay, you can have a very bad allergic reaction that you need to be admitted in the hospital. It can be very, very terrible allergic reactions. But so there are a lot of other side effects, but I am highlighting the most dangerous ones so that you know what you are getting into and roll that dice with your hands to heaven. Whatever you see, you take. So kidney injury, and now a lot of reasons, a major part of why weight loss drugs affect the kidney is that a lot of them cause dehydration. So let me state categorically, and you might want to write this down. If you take any weight loss drug and you realize that you are urinating very frequently, you are sweating a lot, please stop. Please stop. What that weight loss drug is trying to do is to dehydrate your body, to drag out all the water, and that is dangerous for your kidneys. That is in fact, that's the quickest way to cause kidney injury, dehydration. So if you notice that you take a weight loss drug and you're just urinating, you're just sweating, the drug is actively forcing water out of your body. Your kidneys need water. Your kidneys need water. So any drug that draws water out of your body by force, please stop it. It's going to cause kidney injury, and that's just another problem you don't want to deal with. I promise you, you don't want to deal with kidney problems. Okay. Um. So that's that about early starts. Okay, and the same thing applies to Wegovy. Sorry, I didn't mention it. For Wegovy too, it causes dehydration that can cause kidney injury. Very, very important to mention that. Okay, another one to touch up on a little bit is Saxenda. Saxenda, it reduces appetite. Um, so what are the risks? It can cause thyroid cancer. Um, what else? It can cause pregnancy. It can cause pregnancy issues because so it's not supposed to be used in pregnancy. There's one particular drug that I want to talk about because it was the only weight loss drug that I noticed had some good benefits. Um, it had some very, very interesting benefits. I want to try and find that drug. It actually protects the heart. Okay, it was Wegovy. Yes. So, in as much as Wegovy can cause dehydration and cause kidney injury, Wegovy has actually been shown to be cardioprotective. It reduces the risk of heart attack. Of course, like I mentioned, Wegovy is used to treat diabetes. But another benefit that has been observed with the drug is that it reduces the risk of heart attack for people who are overweight, because those kind of people actually have a higher risk of having a cardiac arrest. So Wegovy offers that extra benefit of protecting the heart. Then it will now put the kidney at risk of injury. So, pick the one you want. You protect your heart and risk your kidney. You know, I don't really know how you want to do that mathematics, but that's what the science says. So it's now up to you to decide if you want to risk it. Yes. And the last one I'm going to talk about is contraving. Contraving. Contrave increases your satiety, makes you feel full quickly. Now, if you remember, I have spoken about how you can do this artificially by making sure that number one, you don't wait till you are hungry before you prepare your food or serve your food. Serve your food before you get hungry so you can control the portion. Okay, you can control the portion when you are not hungry. You are likely to pack more food or buy more food or serve more food or cook more food when you are already hungry. So you want to do that before you're hungry so you can control the portion. So what Contravic does is that it just makes sure that when you are eating quickly, you feel satisfied. Okay, that's how it works. So it reduces appetite like that. However, I'm going to ask you, if you want to get this drug, do you eat too much? There are some people who genuinely must eat a mountain of food before they are full. Okay, and they can't seem to feel satisfied until they consume that mountain of food. A simple way to check this is eat a little amount of food, take water, take at least one bottle of water, and wait 30 minutes. A little amount of food smaller than your usual mountain, right? A little amount, take a bottle of water and wait 30 minutes. You should feel satisfied. Now, if you don't feel satisfied, even after waiting 30 minutes, and you notice it's a regular trend like that, then of course it might be a problem and you need to discuss using Contrave with your doctor. Again, like I said, I'm not prescribing, I'm just giving you some information. But typically, if nothing is wrong with you, after eating a little and drinking a bottle of water, you should actually feel satisfied. I removed the food from your front. I forgot to mention that because you cannot be looking at the chicken lap in your front and you say, no, I'll wait for 30 minutes while looking at this chicken lap, and you think you will not feel like eating it. Okay, you remove the food from your front and just do something else 30 minutes and ask yourself, am I really, really that hungry? Okay, so if you realize that you are still very hungry, then that's something that might need medical attention with Contrave. Risks of Contrave. Number one, suicidal thoughts. Okay, so this is the most popular risk that has been associated with this drug because it affects the brain. Okay, your sense of feeling full, and I've explained this before, is that when the food enters your stomach, there are some signals that will be going to your brain to tell your brain that okay, you can stop eating now, the stomach is full. If there is any problem with that signal, it means the person will just continue eating and eating and eating. So what Contrave does is that it makes you feel full by quickly sending that signal to your brain. Okay, that is what it does. However, the side effect that is a risk is while it is acting on the brain to tell your brain that you are full, it is altering your mood, and so it can affect the chemical balance in your brain that will lead to suicidal ideations, make someone get depressed, cause mood changes that can come with suicidal ideations. Person just feels like killing themselves, like life is not worth it anymore. So it's one of the side effects, it's one of the risks of using this particular drug. Also causes seizures, that's convulsion. Can also cause hallucinations, where you start seeing things that are not there. More or less, in simple Nigerian terms, madness. Just in case somebody was doubting what I was saying, yes, yes, contrave can cause madness. Simply put, okay. So, based on this, of course, it is not advised to use this if you are depressed, if you have a family history of depression, you have a family history of psychiatric disorders, um, history of alcohol use disorder, generally things that come with mental health issues. If you had them in the past, you have a family member who has had any mental health issue, you should probably avoid this drug. However, I must emphasize that even without a family history of mental disorder, it can still cause madness. So, just putting it out there. The last point I'm going to make, I've spoken on all the drugs. I want to highlight one. It is a banned drug. It's banned by NAFDAC. All right. It's a banned. It's not just a banned drug. It's a drug. It's a component or an ingredient that has been banned from all drugs. I'm trying to remember the reason why it was banned now. I know I saw it somewhere. Maybe I'll put that on the group when I see it. But the agent is called sibutramine. Okay, sibutramine. I'm trying to remember exactly why it was banned. I think it was causing some heart problems. I'm honestly, it's just skipped my mind. But I saw the reason why it was banned. So it's sibutramine. Sibutramine. Sibutramine is banned. So if you want to even consider any weight loss drug, check, does it contain sibutramine, because that agent has been banned all over the world and in Nigeria. You know that for Nigeria to ban something, it means every other person has banned it. So you can imagine how bad it must be. So that's something to keep in mind. Other points that, like I've mentioned already, Mount Jaro is not a weight loss drug. Ozempic is not a weight loss drug. Okay, I need to keep that in perspective. And with that, we have come to this simple overview. For those who didn't join at the beginning, I had already mentioned pregnancy, breastfeeding, awaiting pregnancy, trying to get pregnant. You have no business with weight loss drugs. Forget about them until you are done with that phase. Okay, they don't do well with pregnancy and with babies. Also, you can't use any weight loss drug for children less than, I think, 13 in most cases. If you have to use a weight loss drug for a child less than 13, you need to see a pediatrician. So, in fact, generally for children and teenagers, it's not advisable to use weight loss drugs. What else? I also mentioned that you cannot use any weight loss drug alone. You must add the lifestyle changes, because whatever changes that drug will help you achieve, you cannot use it for a long time, or you cannot enjoy those changes for a long time, because you have to stop the drug. You use weight loss drugs for a short period of time. Please, if I did not mention, if you weren't here when I mentioned that, I'm mentioning it again. You can only use weight loss drugs for a short period of time. In the long term, it will be very, very dangerous. Very, very dangerous on that line. And like I also mentioned, the people who can use weight loss drugs are people who have a BMI above 30, or a BMI above 27, but the person now has what we call comorbidities, uncontrolled high blood pressure, um, diabetes, um, risk of heart disease and things like that. The weight is just having an impact on the person's health and it's causing other health problems. We call them comorbidities. Okay, so those are the two classes of people: above 30 BMI, above 27 with comorbidities. Yes, these two classes of people can use weight loss drugs. But if your BMI is 26, 27, 25, please go hit the gym. In fact, if it's up to 28, 29 and you don't have any high blood pressure or anything, please do your lifestyle changes. All right. Above 30 is what we call obesity. And that's where a doctor can consider prescribing a weight loss drug for you. Now I will take questions. I think I am done with this topic. So if anyone has any question, you can type your question on the group, or you can type your question in the comment section and I will respond to your question. Meanwhile, so just to put everyone on notice, um, so we will be shifting a bit into practical sessions. We'll be moving away from the session where we just come and sit down and just listen and listen and listen. We're going to be having more engaging sessions, more active sessions. Because I mean, the goal is weight loss. So even if it's on Sunday alone, where you have to do something targeted to your weight loss journey, or your blood pressure control, or your blood sugar control, mental health, we will pick exercises that we'll start to do as a community in the coming weeks. I'll try and work on that. Meanwhile, I can see someone already typing a question, so I'm just going to wait for that question. So we may or may not have a session next week because I want to get everything properly prepared and sorted out. So it depends on how the week goes, on how well I can sort things out. But I'll keep the group updated on that. We need to shift into something more practical, something more energetic, something that at least every Sunday at 4 p.m. there's something you are doing about your health goals, aside just listening to information. So I just felt I should let everyone know that. So get ready. It's coming soon. Get your sneakers, get fitted, get your exercise wear, a random round neck shirt and shorts, you know. Okay, question. Is it possible to have normal BMI yet have high blood pressure? If yes, what could have been the reason? Okay, so this is pretty straightforward. There is, okay, there are two types of high blood pressure or hypertension mostly, right? Primary hypertension and secondary hypertension. Secondary hypertension is the type of hypertension that is caused by something. So we say um, hypertension or high blood pressure secondary to, all right, because there's something causing it. On the other hand, is what we call primary hypertension, where the blood pressure is just high for no reason. Yes, we talk about stress, we talk about all these things. Now, all these things are contributing factors that could be pushing the blood pressure up. True, they are contributing factors that could be making the blood pressure higher than what it should be. True, but there are cases where someone just has high blood pressure and there is nothing involved. So, yes, it's possible to have a normal BMI. Nothing else is wrong, but the blood pressure is just high. In the same vein, it is possible to have a high BMI, very fat, but the blood pressure is normal, right? So when we talk about blood pressure, most of the time we don't say this is the cause of blood pressure. We say these are the risk factors because we really can't say there is one thing that will always cause high blood pressure. There is nothing that we can say will always. Of course, there are things that will increase the blood pressure. Anything can increase your blood pressure. If you just hear a gunshot right now, your blood pressure will go up. But we're talking of hypertension as a condition. Okay? We have not really found factors that cause hypertension directly all the time. Like mosquito and plasmodium cause malaria. We don't really have that for hypertension. Again, primary hypertension. But for secondary, yes, there are a number of situations where, because of one thing or the other, the blood pressure is high until that issue is addressed. Now, so yes, so to answer this question, yes, it's possible to have a normal BMI with high blood pressure, and the cause of such a blood pressure of such a situation where the blood pressure is high despite a normal BMI could be anything. Can be stress, it can be that, again, like I said, risk factors. risk factors. Stress, the person is not sleeping well. It can be um, kidney issues. It can just be the fact that the blood pressure is high for no clear reason. A family history, father and mother had high blood pressure, and so the person now has high blood pressure despite the fact that the BMI is normal. So it could be any of these things. Could also be diabetes. Okay, so yes, so BMI is just one thing that it's just one of the many risk factors that puts people at risk of having hypertension. So I hope I answered that question very well. And uh, okay, yeah, so it seems that's the only question. So in the event that there's no other question, please, like I was saying, um, get ready. We're going into more practical sessions. We actually want to practicalize a lot of things. And assuming that that question is well received, or the answer to the question was well received, I think we can close the conversation. There's no other question. Please take everything I have said into account. If there's nothing you remember from today, remember three things: Ozempic, Mounjaro, Sibutramine. Don't touch. Don't touch. They are not approved for weight loss. Okay, Ozempic, Mounjaro, Sibutramine. And with that, we've come to the end of this conversation. I hope everybody had a wonderful session. Feel free to still drop some questions on the group if you have any, and I will give you feedback. Thank you all so much, and have a wonderful week ahead.